It's my pleasure to welcome Pat Courneya to our stage, and he's going to be moderating our next panel. Pat is the Executive Vice President and Chief Medical Officer for National Health Plan and Hospitals Quality for Kaiser Permanente in Oakland. And in this role, he oversees Kaiser Permanente's national quality agenda, helps ensure that our members and communities receive the best quality and service Kaiser Permanente can offer, and advocates for the advancement of evidence-based medicine and proven innovation for the industry. And I'll let you introduce our evidence panel. So, Pat, thank you.
Thank you, Murray, and thanks for the chance to moderate what I think is going to be a really very interesting and exciting panel. So if you could all come on up. I'll set the stage a little bit and introduce you and give you a chance to present your materials. A lot of really interesting things that I think we're going to talk about here. Just by way of background, I feel as if I have been delivering telehealth services since the start of my practice, and we talked about that a little bit earlier today, the idea of basically connecting a patient's problem to whatever expertise or information they need, or their curiosity or their questions to the answers that they need, whether that is by telephone, which is what I'm talking about in terms of delivering telehealth services, all the way through to newly enabled and much more smooth and effective approaches to connecting those patients' questions and problems to the expertise and information necessary to resolve those problems. So if we think of it in those terms, while there are new tools and new ways of designing the experience that didn't exist years ago, those are fundamentally the things that we are looking to achieve. I've actually been seeing demonstrations of things like video visits since the early 90s. It never has gotten the kind of traction, though, that it needed, partly because the technology wasn't advanced enough to put the tools easily in the hands of the patients and the providers and others who are members of the care team that we needed to be able to realize the promise of that. One of the other challenges that we face, though, when we begin to bring those problems together in fundamentally new ways that overcome the barriers of geography, is that we create a whole new set of different venues that we need to pay attention to when it comes to understanding the quality of the care, the quality of the experience not just from the patient's perspective, but from the care team's perspective, and doing so in a way that helps us to understand whether or not we're delivering and designing those interactions in ways that are satisfying to all. And then there's also the question of whether or not it does indeed make care more affordable. Does it do so in a way that doesn't duplicate care, but actually substitutes for more expensive care, resolves questions or problems that would have ordinarily been brought forward in a face-to-face visit in a completely new way. And then also in expanding the capacity in the different venues, does it give us the opportunity to solve problems that we weren't able to solve before? Being able to understand that is critically important, and in order to do so, we have to have a framework to understand how are we performing when it comes to quality, how are we performing when it comes to experience, and how are we performing when it comes to the affordability dimension of this, which is critically important. Unfortunately, the available information has been relatively scarce. I have been involved with organizations, with an organization such as Virtuwell that has done some of that work to demonstrate the ability to intentionally design a system that substitutes in-person visits for virtual visits and does so in a way that actually saves money, delights patients, and drives better quality. So it is possible. And those experiences for me have given me some pretty strong opinions about what it is that we need to do in order to assure quality and ensure clear understanding of the performance of telehealth services for our members, for our patients, for our communities. And so that really is, I think, a very important conversation, understanding what we have been able to achieve so far and understanding where we need to go. And that's the intention of this panel. The panel includes Jason Goldwater, who works as a senior director at the National Quality Forum, and he oversees activities related to the evaluation of electronic clinical quality measures, as well as projects focused on the use of electronic health to improve the quality, safety, and efficiency of health and care, basically what I've just been talking about. He holds a bachelor's degree and a master's degree from Emerson College and a master's degree in public administration from Suffolk University. Mary Reed is a research scientist for Kaiser Permanente. Hi, Mary. And she is in our Northern California division, and her research interests include the impacts of patient and clinician-facing health information technology on clinical care, quality, and outcomes. She holds a doctorate in public health from the School of Public Health at the University of California in Berkeley, and completed a postdoctoral fellowship at the Institute of Health Policy Studies at the University of California in San Francisco. And Neela Sika, a physician who is associate professor in the Department of Emergency Medicine at George Washington University. Neela is an associate professor at George Washington, as I said, and health sciences, and the chief of innovation practice and telehealth section at the George Washington Medical Faculty Associates. He earned his medical degree at Washington University in St. Louis and is board certified in emergency medicine. And with that introduction, I'd actually like to welcome you, Jason, to the stage.